Can you hear me?
Yes, sir.
Please mute yourself. Dr. Samina Kausar, please mute yourself. Very easy for me. Okay. Just let me check. Okay, today we will discuss reading tips and tomorrow we will do speaking. Okay, good morning, good evening, all of you. I'm DrChe and today we will discuss some important reading tips. We will continue the same sample that we have done yesterday, reading part A. Yeah. Can you hear me? Can you hear me? Okay, I have to allow you to unmute because there was a lot of noise. So, can you hear me now? You can unmute now.
Yes, sir.
I
Okay,
can hear
thank
you.
you, all of you. So today we will continue reading part A and tomorrow we will do speaking. If any doctor or nurse wants to participate for speaking feedback, whose exam is close, then you can contact me on my WhatsApp so that I can schedule your speaking. Okay. So today we will continue reading part A. And what is the importance of reading part A in OET reading? Can anybody tell me? What is the importance of reading part A?
Sir, it's a easy part and we can get good marks from here.
Yeah.
So it would be easy to
So
pass the exam.
yeah, it's very easy. There are 20 questions and most of them are easy. Almost 12 to 15 questions are easy. If you do these easy questions quickly and then you have 4 or 5 questions a little bit difficult, you spend a little bit more time on these questions, then it becomes easy for you to get a 19 out of 20, 20 out of 20 reading part A. If you get this score in reading part A, then it becomes easy for you to score B grade in complete OET. Okay, so Nasir Mazur, please mute. Okay, so now today we will continue this sample. So we have already done a skimming and scanning in these things, and maybe there is someone new today. So I will just quickly go through the main text. So in just a quick recap, how we do reading part A is very easy. Just do skimming and scanning. Okay. just do skimming and scanning. Skimming and scanning is just to see what are the main topic and what are the headings, subheadings. Okay, so if there is any date, first sentence of each paragraph is important. We call it as uh, topic sentence. Topic sentence, okay, because usually they give the main idea of the paragraph in the first sentence. Any brackets, any dates, okay. So can you hear me? Because someone is saying they can't hear me. Can you hear me?
Yes, sir.
Okay.
We can hear.
So if someone cannot hear me, it means there is some issue on their side. Okay. So skim and scan the main things, okay, just quickly. It would help you at the end when you will start the questions. It would be easy for you to come back. Please turn off your video, Kang's iPhone. Okay. So it would be easy for you to come back to the text, okay, in which you can find the answer. For example, if the one question you can easily find in text A, but you start finding it in text D, okay, then you will spend a lot of time in text D finding the answer. If you remember yesterday, we had this question in which the keyword was Canadians, this Canadian blood services, okay, if you remember, yes or no?
Yes, sir.
Yeah, this
Yes,
was the
sir.
keyword. This was the keyword, but the same keyword, this keyword was given somewhere else. And my question was, most of you were trying to find in this paragraph uh, the question that was about Canadian blood services. Okay, and you spent a lot of time, and at the end, most of you were trying to just force yourself to find, to find some answer here and give the wrong answer. But your answer was not there. Your keywords, all the keywords are not matching there. Your answer was here in this text. Here it is written Canadian blood services again here. Okay. So this was not a difficult question, but how I am trying to examine you or test you by wasting your time. Okay. If once a student sees just how we make the samples, once a student see Canadian blood services here, okay, this one, they will stick here in this part and they will try to find the answer in any way, even if their keywords are not matching. Okay. And how this is how you will waste your time. Okay. So now just quickly overview of the text, and then we will start from the question where we ended yesterday's class. Okay. This complete text is about blood transfusion. In reading in text A, there you are talking about treating blood loss. Blood loss may result from this, that, anything, okay? If two blood is lost, then what we give blood loss can be reduced number of oxygen carrying cells, okay? Then whole blood is giving to the treating blood loss, to treat blood loss. Instead, you are given blood components. So in this complete paragraph, they're talking about blood components, okay, which you give. Then in next paragraph, blood loss during surgery sometimes can be recovered, clean and returned to the same patient, okay. They're talking about this. So you don't need to go into details. Just now I am doing like the real exam, okay, quickly, okay, because we have already done it in detail yesterday. In text B, you can find different types of blood collection. Can anybody tell me what you will do, how you will do skimming and scanning of this? Just quick skimming. How you will do for text B? Yes, please. How you will do?
Key points, keywords.
Just tell me
We
what are the
need to
keywords
start.
here, just please, in text B.
The keywords here is like the whole plot homologous, then apheresis collection, autologous collection, matched collection.
Yeah.
We have four main components we have to concentrate on.
Okay. So first of all, this is the main heading. There are different types of blood collection. Then we have main ways and you have less common ways. Here you have whole blood collection. Whole blood is collected, okay? So you don't need to go into detail. Apheresis collection. So maybe there are some nurses or other professionals, they don't know what is apheresis collection. You can just quickly see only some components, okay? Either plasma, platelets. Now you know what is type of this collection is. Then you autologous collection. Before a scheduled operation transfusion blood, a person donates blood specifically for their own use. This is autologous collection. Then we have matched collection, where the donor has been identified as match for a specific patient with a rare or complex blood group. No, just quickly skim and scan. This is the quick skim and scan for this text, okay? Then you have a table. The main heading is blood transfusion reactions. Now they are talking about reactions. If you see here, okay, these are the complications. These are signs and symptoms, treatment, and their extraneous means extra information. So here you have febrile transfusion, hemolytic, allergic, TRALI, TACO. You don't need to go into detail. There are symptoms, just you can see temperature, fever, like just quick, okay? Then there's treatment, supportive, stop transfusion, symptomatic, stop transfusion, give blood slowly, quickly, okay? Just extra information, most common, worst reaction. You can underline these, okay? They're not actually allergic, most common cause of death, often elderly, okay? This is just quick skimming and scanning of this table, okay? Then you have text D, in which they are talking about safety and safety of donated blood, okay? The process of blood donation and the healing of and handling of donated blood is regulated by Health Canada's Therapeutic Product Directorate. They are talking about Canada's health system of, safety of donated blood, okay? Now, donor screening, donated blood, you must answer a series of questions, okay? Traveling, disease, okay? Your temperature, blood pressure, so then deferred donor lists, okay? So then you have blood testing of these things, then you have quarantine, then you have quality assurance. This was just quick skimming and scanning, okay? Then you have two methods. You can start from question number 1 or you can start from question number 6 or 8, okay? It depends upon you, which method suits you better. How many questions we have done yesterday of this sample? How many questions we have done yesterday of this
Sir, I think
sample?
13.
People on Facebook, I can see your comments. You can chat, you can comment below the video. I can see your comments. If you want to participate actively, I will answer your questions also.
Maybe 10, sir. 10, but because
10 due to degree
10.
risk of what? Yeah, there was reactions, if you remember, answer to this question. Due to degree risk of what? Locus blood transfusion is needed to be safe, okay? Reaction due to degree risk of reactions. Okay, so we will start from question number 11. This is fill in the blank, okay? Fill in the blank. Where the name of a patient should be included if he or she had hepatitis after 11 years of age. In which text you can find the answer is possible, just possible. 11, question number 11, in which text you can find the answer? Where it is possible? Can anybody talk with me, or you can write something in the chat? No? Can you hear me? Can you hear me?
Yes, sir.
Yes.
In
Yes.
which text
Yes,
is possible? Just this is just a guess, okay? Just guess what in which it is possible. Maybe they're talking about hepatitis, okay? About tests about hepatitis. And C,
I think it's in
where was
C.
screening was, yeah?
It's C.
If you remember, the screening is mostly in D, not in C. Is there any mention of hepatitis here in C? Screening? No.
It's in D, sir.
It's
Yeah, maybe the
D.
Sorry.
last one, yeah.
Yeah, the last one. Okay. Can you find the answer here in this part? Just quickly so that I can show you other part of the text. In these two paragraphs. What are your keywords? Hepatitis, 11 years,
Yes, 11 years, I find that.
and hepatitis, okay? And
Yes,
hepatitis, and screening.
referred donor list.
Yeah, so here you cannot find in these two paragraphs, okay?
No,
So I will
yeah,
show you.
next
Yeah,
after it, yeah.
yeah. So
You can
please
see
don't
that
give your answer. Don't give your answer.
had hepatitis
Just
after age 11.
please. Just write in the chat. If you find the answer, write in the chat that what is your answer, okay? Don't discuss here because I want to test others also. Where the name of a patient should be included if he or she had hepatitis after 11 years of age. This is fill in the blank, not only in which text you can find the answer. Just in the chat, please. Someone has given incomplete answer. Please give complete answer. Shahnil Khan, please give the complete answer. Your answer is incomplete. So where the name of a patient should be included if he or she had hepatitis after 11 years of age. Okay, so your keywords are matching here. 11 years of age and hepatitis, okay? Okay. After finding your keywords, what you need to do? After finding your keywords, what you need to do? There are three strategies in reading. Number one is skimming, scanning, and number three is thorough reading, okay? Extensive or intensive reading or complete reading, you can say. So after you find your keywords, you have to read this sentence, okay? After reading this sentence, if you're still unable to find the answer, then you will read this complete paragraph. This is how you will save your time, okay? So you match your keyword hepatitis after 11 years. It is given here, okay? Quickly. Then read this sentence. If you are still unable to find the answer, then read this paragraph, okay? So if we read this sentence, can anybody tell me what is your answer?
sir, deferred donor list.
Very good. How you were able to find the answer? Okay. The deferred donor list includes people who have had certain types of cancer, had hepatitis after 11 years of age, and are at high risk of HIV infection. Where the name of a patient should be included if he or she had hepatitis after 11 years of age? No, is the answer is deferred donor list, okay? So here you should include the name of the patient if he had hepatitis.
So,
Next question. Easy question, yes?
should we write deferred donor list or the deferred donor list?
Both are okay. No problem in OET.
Okay, sir. Thank you.
Yeah. But list should be included. You cannot say only deferred donor. No. In the list should be included.
Okay, sir.
Okay. So next question. This question is easy, but you will spend some time to find the text and then to find the answer and to think about the answer also. Just remember, as I keep telling the same thing again and again. If in the reading part A, this is the game of time management. You have 15 minutes and you have 20 questions. You have less than 1 minute to find the answer for one question. How much time?
40 seconds.
Almost 40-45 seconds. If I give you 1 hour, all of you will get 20 out of 20 in this sample.
In the real exam, will transfer my answer to the booklet or to the booklet answer first?
No, here on the
Here,
question,
then I have
yeah.
time to transfer.
No, it's not like else. You have to write here, just directly here.
Okay, thank you
But
so
I
much.
remember when I given the exam, maybe they have changed something.
Okay, thank you so much.
Maybe someone else who has given recently, they can guide. But it's mostly in OET is like you will directly write here, but not write on the and listening or something. You have to. Oh, I don't remember other thing, but mostly I think is on the same question paper. Okay, but still they will guide you at the start. Okay. So now next question, in how much time should an old man or woman receive blood to avoid a reaction causing swelling? Now just imagine, this is what you will learn from here. In which text is possible to find the answer?
Text C.
Text C. Where it is possible to find the answer? In which text?
First text.
First? Anyone else? A, B, or C? If you don't want to participate actively, you will not learn anything from this class. Please try to guess where it is possible. Where it is possible, try to guess, okay? And how much time should an old man or woman receive
Sir, I think
blood to avoid a
in
reaction? Where they in which text they're talking about reactions? Reactions. In text A, they are talking about overall what a transfusion. We give parts of blood, okay, and at the end they are talking about autologous. Then they have types of collections. That is not possible to find the answer here. In C, they're talking about reactions. In D, they're talking about safe screening. Okay. So where it is possible to find the answer for this question?
C.
C.
In C, very
C.
good, excellent. Yeah, C, good, excellent. First in C, if you don't find the answer, then you can go to another text. Okay, maybe D. So here is your question, here is your text. Try to find the answer and just write in the chat what is your answer. People on Facebook, you can write your answer in the chat also. Please just write in the chat what is your answer. Very good. So most of you are getting correct. Very good. Excellent. Now, Miss Alia Noor or Dr. Alia Noor, can you talk with me, please? Alia
Yes, sir.
Noor.
Yes,
So
sir.
what is your answer?
Sir, ये due to circulatory overload, there could be edema.
No. You don't need to
No.
just tell me what is your answer. Just answer. No explanation.
Okay,
What
okay.
is your
3 to
answer?
4 hours. If female
No,
means,
no, no. Don't change, please. No.
what, sir?
What was your answer? Your answer was TACO.
TACO, transfusion associated circulatory overload.
Do you write this
Actually,
in the
I'm
fill in the blank? Yes.
one. Yeah, I will write. I will write this one, and I will mention also regarding 3 to 4 hours. How much time
Then you
should
will
I?
your answer would be wrong if you mention TACO and the time also. What they're asking in the question.
How much time?
Even if you write slow, they're not asking the slow, okay? They're just asking in the time, okay? You don't need to
Okay.
mention even slow. Just
Okay.
read the question in how much time.
Okay, sir.
Okay.
Only we have to
Thank you, Dr.
mention time.
Nadeem. Thank you. In how much time?
Sir,
Okay.
less than 3 to 4 hours.
Over 3 to
No,
4 hours.
over 3 to 4
Over
hours. You
3
should
to
write
4
over
hours.
3 to 4 hours. Yeah.
Yeah. Over
Okay.
3 to 4 hours.
And Miss Arya Noor, are you doctor or nurse?
I'm a nurse.
Okay, good, excellent. So how you will find this answer? Because here my purpose is to teach you how to do the reading, not just to do a lot of questions in 1 hour. So how you will find this answer?
First, I
You
read the
have
complete.
you have one complete table in which you have 1, 2, 3, 4 columns. You have 1, 2, 3, 4, 5 lines. Okay. And you have this question. How you will try to find the answer?
Sir, first, actually, how I means um, I was thinking that is the answer because
Yeah.
here is mentioned about circulatory overload, and it's mentioned it here that causing edema or swelling, the same. And anyway, I did not means that you are correct. Over 3 to 4 hours, we have to give the blood because to
No,
avoid
just let
this
me
one.
explain you. That is good. But let me explain you how I will find the answer. And how
Mm,
much time? So my question is, they're asking me time, okay?
okay.
Okay. Should an old woman, a man, receive blood? Okay. Should to avoid a reaction causing swelling. Now,
S-
how many reactions we have? 1, 2, 3, 4,
3, 4, 5.
5.
Yeah.
Okay. You have to find a reaction in which there is swelling. These other keywords are secondary. First, your main keyword is swelling, okay? To avoid a reaction causing swelling, okay? So, where you can find this in sign and symptoms mostly, you can find in extra information also. You will go there in this column quickly. This is what I will do, okay? What I have done, even I don't know the answer before the class. I have not memorized this class before teaching you. I have made this sample in 2022, I think so, almost. So I just open it and I start teaching, okay? Because I have made these samples, I know how to, teach and these things. What I will do is I even don't need to read the name of the reactions. I will just see the swelling here just quickly. Don't read it, okay? Okay, vomiting, dark urine, reflexes, dyspnea, edema. I have not given you exact word edema and swelling here. I am changing the language. So I'm using synonym. I am using similar language, same meaning language. Okay. So now you have edema here. I have some questions in which you can find the edema or swelling in two lines. Okay, here and here also. Okay, but then I will give you another keyword where you can see your answer is in this or in this line. Okay, but here it was only in the last one. Okay, then you need to see edema. This is the reaction. So I'm asking about time and okay, give slow over 3 to 4 hours. Okay. Where you got the elderly, this often occurs in elderly. Okay, so time should an old man or woman. So instead of elderly, I'm using man or woman. Okay. So the things to learn in this question is how you will find the answer in a column. Okay, in a table.
Okay, sir.
Good, excellent. Okay, so next question: which type of blood collection is so? Before even reading next part, which type of blood collection? Just always remember the examiner will give you some clue so that you can reach to the text. Okay, just out of 4 texts in A, B, C, or D. Okay, so here what clue I am giving? Which type of blood collection? So which text? Even before reading next part of the question, in which text you will find the answer? Not in D, in B, where you are talking about the classification.
B.
Okay,
Test B.
yeah,
Yes, sir. B.
in B. Okay, so now let us read the question. Which type of blood collection is suitable for a patient who requires one specific type of blood cells? Okay, so now there are 4 or 5 types of blood collection. You will find one in which patient requires one specific type of blood cells. Okay, no, I will show you the text and at the same time I will show you the question also. Try to find the answer, please. Just write in the chat, please. People on Facebook, I can see your comments if you want to answer anything. Okay. Very good, excellent. Okay. Someone told me here one option was Remia Sijiman. Can you hear me? The answer does not match with other people, and also Sandra Kellen, whatever your name is. Anyone of you? Dr. Sumair?
Yes, sir.
So what is your answer?
Says autologous collection.
Very good, excellent. So how you will find this answer?
Sir, see in the text before a scheduled operation or transfusion, a person donates
Yeah.
blood for their own use. This is often when the person has a rare or hard to find blood type or to create specific blood product for them.
Okay. People, you can find the similar words in autologous collection. You can find in apheresis collection. You can find in whole blood also. Similar words. but you have
Yes,
to
sir.
select one best option.
Yes, sir.
You can justify it could be, but this is not the best.
Yes, sir. Which type of blood collection should require one specific type of blood cells? The question is require one specific type of blood cells.
Yeah. Just see where they mention exact name of specific type of blood cell, blood type, blood product type.
This is
A
often
specific
when
type
the
of blood
person.
cells. Even they are asking blood cells. If you go
Sir,
into too much detail.
this is often when the person has a rare or hard to find blood type or to create a specific blood products for them.
Try to find in above 2-1 whole blood and apheresis collection.
So, only some by the plasma taken from the blood of sheets, cell, give the red blood cell. Apheresis collection में.
Apheresis collection, very good. Even you can find similar thing in first one, but they're mainly they're talking about whole blood collection. Okay.
Yes, sir.
So here only some component. You may even take first of all whole blood, then you can get some components out of it. But this one is specific, only some components, either plasma or platelets. They mention type of cells. Which type of cell? Plasma is not type of cell. Platelets is type of cell. You can say
Yes, sir.
white cell, and platelets. What else? You have red blood cells in our blood when we donate. When we receive or donate in just in types of cells, you can give to the patient platelets. Some patients can get only white blood cell, and some can get white blood cell, platelets, and red blood cells. Yes, these three things, and plasma separately. So plasma is not type of cell. Okay.
Yes, sir.
Platelets is type of cell. Okay.
Yes, sir.
But you do not need to go to too much depth. Maybe some nurses are thinking this is too difficult for us. If you read these two, overall, with a common sense, you can see that your answer is not whole blood. Your answer is apheresis collection. Okay, whole blood collection.
Yes.
The name indicates it's whole blood. Okay? Here is apheresis collection. Here, autologous collection is mainly is complete whole blood, but you can sometimes take some components, but mainly is whole blood also. Matched collection is mainly the whole blood also. Okay.
Yes, sir.
With good question. Okay.
Sir,
Sometimes you get confused in the real exam also. Yes. Yes, please.
sir, I have one question regarding
Yes.
how we decide that we should write down the apheresis or apheresis collection. So if you read the question, they're asking which type of collection. They already mentioned the collection. So we should write down only the apheresis or apheresis collection.
Both are okay.
So
If you read only apheresis is okay. You read apheresis collection, both are okay. They're not
Sometimes
strict
they're
about
telling that
these
you
small things.
Okay, sir.
Both are okay. Both are perfect. Okay.
Okay, okay.
Yeah. They're not strict. In OET, they're not strict. This is not like IELTS. In OET, they're flexible. They're broad-minded. Okay. Whichever regulation is suitable. Okay. So next question. This part is a little bit like a question. So you ask a question, at the end you find the answer. Now this is like the fill in the blank. Okay. Just you have directly a blank in the sentence. Okay. A patient cannot keep dash in normal levels if a large amount of blood is lost. So now, in which text is possible to find the answer? In which text?
Text A.
Text A, very good, excellent. Okay. So we will copy this question. We will go to the text. We will try to find the answer there. Okay. Now try to find the exact answer and write in the chat, please, quickly. quickly, please. Very good. So your answer is blood pressure. Very good. A patient cannot keep blood pressure in normal levels if a large amount of blood is lost. Very good. Very easy. If too much blood is lost, a low blood volume, your body cannot maintain a proper blood pressure, which results in shock. Okay. Blood loss can also reduce the number of oxygen-carrying red blood cells. Some of you may argue that the answer could be oxygen-carrying red blood cells. Yeah? Yes or no?
Yes, sir.
If there is blood loss, there is decreased number of oxygen-carrying blood cells also. But if you see the keywords, mainly the normal level is written here with blood pressure, okay, maintain a blood pressure, okay. Your body cannot maintain a blood pressure, okay, which is also there is a high blood volume loss, okay. So your answer is blood pressure, okay, not red blood cells. Very good, excellent. Next question is, donor's blood is dash if it is tested positive for syphilis. Now, in which text is possible to find the answer? Very good, Muhammad Abdullah Khan from Facebook. You are saying blood pressure. Very good. In which text is possible to find the answer?
Text D.
Text D. Yeah, they're talking about screening and these things in text D. Okay. I will show you text D in two parts. First, try to find in these two paragraphs. If you cannot find, I will show you rest of the. What are your keywords?
Syphilis.
Syphilis. Okay, try to find the syphilis. Okay, here. Can you find the word syphilis in these two paragraphs? I think no.
No, sir.
Okay. Now you have this part. Try to write your exact answer in the chat.
There is in the blood testing.
Please
That
in the
would-
chat, your answer in the chat. Answer in the chat. Very good. Very good, excellent. So answer is thrown away. You might be a little bit get confused. So how it could be just thrown away? You are thinking donor's blood is unuseful, unmatched, contaminated, okay, like this. But you have to find the answer in the text, okay? If donation, every unit of blood is tested for certain disease, so syphilis is given here. So then your answer is not in this sentence. You will continue reading if any disease is detected. If any disease out of this, okay, detected, the blood is thrown away, okay? So donor blood is thrown away if it is tested positive for syphilis. I'm just asking one disease out of these, okay? Easy question. Just you will spend some time to reach the exact place, okay? Next question, which type of blood reaction can occur in a patient who is even basically not allergic to blood, okay? Now, in which text you will find this answer? In which text?
C.
Muhammad Abdullah Khan, you are on Facebook, you can answer.
Text C.
In text C?
Yes, sir.
It's possible in C, yeah? Okay. Let us go to C. Very good. So here is your text C. So here is your question. Try to find the answer, please. Okay, quickly. Just in the chat. Right in the chat. Keywords. Remember your keywords. Keywords. Match your keywords, please. Very good. Very good. Try to find the answer. Those people still, I'm waiting for other people. Alinur, very good. Excellent. Very good. Who will participate and will explain me what is the answer? Yes, please. Who will participate? Dr. Ahmad.
Yes, sir.
Yes, please. Okay. Shahanil Khan. Okay, what is your answer?
It is, sir, allergic reaction. I
Okay,
straight
so
went
how?
for not allergic, so I
Okay.
found an extra an allergic reaction.
Yeah, very good. So your keyword is no allergy to blood. So it
Yes.
would not be in complications, it would not be in symptoms, it would not be in treatment, okay, mostly.
Yes.
Most likely it is in extra information, okay. So if you go into extra information, so here in this, they're not even actually allergic to blood, okay, but secondary to antibodies. So here I'm asking, which type of reaction can occur in a patient who is even basically not allergic to blood? So this is allergic reaction. So type of blood reaction is allergic reaction, okay. Very good, excellent.
Thank you.
Okay, so next question is, a patient's O2 requirements might not be fulfilled if blood loss has resulted in decreased dash. In which text is possible to find the answer? In which text? A. Very good. You people are very intelligent. Just you need, little bit guidance. And you're intelligent. You're a genius. Just you need a little bit guidance. Okay, how to do the reading samples and how to improve. Okay. So write in the chat, what is your exact answer? We have already discussed this, the similar thing. What are your keywords? What you are looking for? Write in the chat. What you are looking for? What are your keywords? Very good, excellent. Okay, so try to find the exact answer. Excellent, excellent. Okay. So still your answer is not there. You have to give the answer. You are still giving the keyword. Try to find the answer. Very good. Excellent. People on Facebook, try to find your answer also. What is your answer? Very good. Okay, excellent. So it's very easy. If you read this, oxygen is here. The word oxygen. Oxygen is here also. It prevents oxygen from reaching the rest of the body. A patient's OT requirements is requirement here. Okay. May not be fulfilled if blood loss has resulted decreased. So decrease is reduced number of. Decrease is given. So you can say just red blood cells is enough. Or you can say oxygen carrying red blood cells. But most appropriate would be red blood cells. Okay. Both answers are okay. Oxygen carrying red blood cells and only red blood cells. Both are okay. Better is only red blood cells. Very good. Excellent. Okay. Next question. Now you people are very good. So just we have 3 more questions. A term that is used for volume of red blood cell found in a specific sample of blood. No, nobody will answer on call. You will just write in the chat. In which text is possible to find the answer? For question number 18. In which text? Because you will getting very easy questions. Know where you will find the answer. In which text? In which text? Yes, please. In which text you can find the answer? In text B? No one is answering. In which text you can find the answer? In A? In A, B, where? Quickly, please. Oh, you're a little bit slow. Why? A term that is used for volume of red blood cells found in a specific sample of blood. In which text you can find the answer? Where it is possible. Just guess where it is possible. We will go there. We will see if the answer is there or not. If the answer is not in that text, we will move to other text. Okay. Where it is possible. Muhammad Abdullah Khan, very good. You are active on Facebook. Where it is possible, people? Are you sleeping? So most of you saying A or B, okay? I will show you text A, okay, and then I will show you the question. Try to find the answer here quickly, please. We have very short time. We have just 2 more questions to go. Quickly, please. Very good. Excellent. Excellent. Very good. Alianur. Very good. Are you a doctor or a nurse?
Sir, nurse.
Very good. Okay, so what is your answer? What is your answer?
Packed red blood cells.
In which line, which paragraph?
Sir, it is here mentioned, no?
In which paragraph? There are 3 paragraphs.
Second.
Second paragraph, which line?
1 minute. If you have lost too many red blood cells or not making enough of them, you are given.
Just give me the line, please.
Sir, second line.
Second line, this one?
No. In the second paragraph, sir.
If you have this one, if you have lost this one, this one.
Yes.
If you lost too many blood cells or not making enough of them, you are given packed red blood cells. A term that is used for volume of red blood cell found in a specific sample of blood. I cannot see any relation between any, keywords, any similar things between these two sentences. A term that is used for volume of red
No,
blood
actually
cells found
the term, sir, you asked about the term. So that's why it is in my mind, packed red.
Even if it is term, but this does not. A term that is used for volume of red blood cell found in specific blood or specific sample of blood. Okay, if you lost too many red blood cells or not making enough of them, you are given packed red blood cells. This is not even relevant to the question.
Okay, sir, I will check again.
So here is not your question. Try to find anywhere else.
Okay.
In this sentence, you cannot find the answer. You have to fill in the blank. This is not your answer. Is volume given here, the word volume here in this sentence? I will give you some tips. No, volume is not given in this sentence. Okay. Let me help you. Your answer is not in text A. Okay, where else we should go? Your answer is not in text A. Where else we should go?
Sir, B, C, D.
B, C,
Actually,
D. Okay, yeah. Let us to go one by one. Okay. Now is B. Try to find your keyword. This one is the question. The last one at the end is the question. Can you match your keywords here just quickly?
Sir, first one, homologous. The term.
Write in the chat, please, what your answer. Okay. Write in the chat your answer. This is fill in the blank. Okay. It's not in A. Can you find the answer here? Just be quick, please. You will have only 15 minutes. Miss Arya Noor, can you find some keywords here in the phrases collection?
Specific, sir, and there is actually here it's mentioned some components.
Is it mentioned
Any type
volume of red blood cells is mentioned there?
No, sir.
Okay. Yeah, so your answer is not in that subheading. Find somewhere else. If you cannot find here, we can go to other text, okay? Okay. Answer is not here. Someone is saying very good. So where we should go now? I think it's not possible and find in C. You can just quickly go through C if you can find here. Volume of red blood cells somewhere given here.
No, sir.
No. Okay. Now try to find here in text D. I will show you text D. Try to find here. Just write in the chat. If you find the answer, write the answer in the chat only, please. You know the question. I will only show you the text. Very good. Excellent. 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 Very good. Try to match your keywords. You can find the answer. Very good. Kezia and Dr. Abdullah, both of you very good. Next time you can text me on my WhatsApp. Those who are on Facebook, you can text me on my WhatsApp. You can join me on Zoom, okay? You can directly talk with me instead of chatting and writing there. You can directly talk with me, okay? Kezia and Muhammad Abdullah, very good. Just mention your name when you text me on my WhatsApp. Mention your name. My WhatsApp number is given on my Facebook page everywhere. Very good. Okay. Alia Noor.
Yes, sir.
Miss Alia, what is your answer?
Sir, I didn't find until now. That's why I did not write.
Okay, no problem. I am waiting for you. Don't see in the chat because in chat there are many correct answers. So your keywords is volume of red blood cells in some blood, okay? So you will use some term for that. Okay, someone else. Okay, Farman Khan, Ahmad. Mercy, Kangas, iPhone, Muhammad Majid. Any of you, Dr. Prakash?
Yes, sir.
What is your answer?
Is a hematocrit, sir?
Very good, excellent. Was it difficult question?
No, sir. It was not difficult, but we are in
It
the
was
wrong
not
text actually.
difficult.
Hello.
Okay, can you hear me now? Yeah, can you hear me? I got issue with my internet. Okay, can you hear me?
Yes, sir. Yes, sir.
Okay,
Yes.
okay. Thank you. So, what is your was this Dr. Prakash? Was this difficult question?
No, sir. It was wrong with us. We can't understand the
sir.
question actually.
The question was easy,
Yeah,
but
but we interpreted very wrongly.
the examiner is not a fool person. Okay, if you remember, if you remember, all of you doctors and nurses, all of you were giving correct answer quickly in this question, also, in this question also. Yes or no?
Yes.
Yes, sir.
Yeah. You were thinking we are genius and we are intelligent. No, we are experts. We will do reading 20 out of 20. Okay. But the examiner is not a fool person. Okay. They're intelligent. Okay. They will give you some questions where you will waste your time. This was not a difficult question. This question was just to waste your time. How you will waste your time? I am not giving you clue of the text in which you can find the answer. If you are not done, if you are not read the complete text, okay? So if you are an intelligent person, okay, your reading skills are good, then you will quickly skim and scan in text A, you don't find the answer, go to text B, you don't find there, in C it is not possible, in D, just match the keyword, you will easily find your answer. Okay. What you have learned from this question? What? Prakash. What you have
Sir,
learned from
try
this question?
to don't jump quickly. Try to understand the
Yeah,
question, pick the keywords,
yeah.
and match it.
Pick the keywords. Match the keywords, okay?
Yeah.
Some of you were trying to find the answer in A. There are the red blood cells is mentioned there, but the exact answer is not there, okay? Try to find somewhere else also if you don't find the exact answer in one text, okay? Another thing is time management is very important in reading. Even one important tip is here is that one important tip here. I think I have not discussed that tip before in my reading class. The tip is that if you find any question on which you are spending a lot of time, try to skip it and answer other questions. Try to mark it here, just circle a little bit, just one dot here or something here. And try to, maybe your next question is very easy. Your next question is very easy. And if you try to keep finding this question number 18, maybe your time will finish, okay? Your 15 minutes will finish. You will not be able to find this question, this answer, and you will lose 19 and 20 also. Maybe 19 and 20 is easy. This is important tip. Okay. Can anyone paraphrase what I have said? What you should do?
Yes, sir.
This is
If we
important
have
tip.
difficulty to, yeah, if we have
Yeah.
feeling difficulty to find a answer, just leave it, skip it, and go another question, solve another question, and at the end come on the same question that you left before.
Yes. Reason?
To save your time and get a maximum marks of it, which are very easy question, and you
Yeah.
skip it.
You will have 1 mark for this question. For example, if at the end you have 2 minutes or 3 minutes, okay, believe me, you will not be able to find answer to this question in 2 to 3 minutes. Because I am the examiner. I have made this sample. I know most of you are answering question number 14, 15, 16, 17 very easily, okay? So I must give something that is a little bit challenging for you. It's not impossible, little bit challenging. So if you find this answer difficult, leave it. If you're spending too much time, go to the next, okay? Maybe you are able to find the answer for 19 and 20 in just 1 minute. You can come back to number 18, okay? Very important tip, okay? I just remember today because we spent a lot of time on this, okay? Without necessary testing, donor's blood should not be transfused to a patient and should be, okay? So in which test is possible to find the answer?
D.
In D, okay? You know in D, yeah, very good, okay? So try to find here, please, if you can find the answer here. Where they're talking about testing? Okay, try to find the exact answer, please. I can show you rest of the text also if you don't find the answer here. Can you find the answer here?
No, sir.
Can you find all of your keywords?
Yeah, isolated, I think the answer would be.
Okay. Very good. So what is your answer?
Isolated, should be kept isolated.
Okay, write in the chat what is your answer. In which part?
In the quarantine, donated blood is kept isolated from other blood and cannot be used for
Which
any
heading?
purpose until it
Which
passes
heading?
out. In the donor screening, in the third bullet on
Quarantine,
Okay,
quarantine.
okay. So let us for other people to find the answer. Just don't tell me. Write your exact answer in the chat, please. Okay, doctor, where is your answer?
the donor screening, the
In donor
subheading,
screening.
third one. Yeah, in the
Third one,
third
this one,
subheading,
quarantine.
quarantine, donated blood. Yes, sir.
Donated blood is kept isolated from other blood and cannot be used for any purpose until it passes all required tests. Without necessary testing, donor blood should not be transfused to a patient and should be isolated. Very good. Excellent. So what is the answer?
Isolated, sir.
Isolated, okay. Should be isolated. Very good. Good, okay. It's not straightforward question, by the way. Little bit tricky also. Not too tricky, but you will spend some time to find the answer. I know. And even some of you were not able to find so far. What is used to separate different types of blood cells from donor's blood? In which text is possible to find the answer?
Mm,
In which text?
D or B?
Try to find and see. Maybe let me see in the chat what people say. B. Okay. Most of you are saying B. Try to find the answer. Here is your question at the end. Okay. Very good. Excellent. Dr. Sumer, very good. Miss Ronjina, very good. Miss Alianur, very good. Excellent. You should use article here also if to just to write a grammatically correct sentence. You should use article also. Okay, very good. So your answer is machine. Only some components, either plasma platelets, are taken from the blood of the donor. A machine separates the cells and gives the red blood cells or red blood cells and plasma back to the donor. Okay, so what is used to separate cells? A machine. Okay, so our answer is a machine. Machine will be correct also, but the exact answer is a machine. Okay. Do you have any questions? Any question? Anyone wants to ask any question? Any question? So we have VIP hybrid course for writing, in which you will get feedback on your writing, individual feedback. You will get model answers. You will get each and everything about writing. And we have individual speaking. You will do role play directly with me. I will give you feedback. Okay. So these are paid classes. If anyone wants to join, you can, or any of your friends. Okay. Another thing is, please, for the free classes, try to invite your friends. Okay. I'm taking these free classes after 1 year. After 1 year. Okay. So it demotivates if we have less number of students, it demotivates. Okay. Because nobody is paying me anything and I am just,
Excuse me, sir. Excuse me, sir. Hello, sir.
I